Latest on the coronavirus now, where the CDC has released new guidelines for people who test positive for COVID-19. The quarantine period is shorter, but it all depends on a few things. KCRA3's Aixa Diaz joining us live in our Washington newsroom now to go through all the details. Good morning to you, Aixa.
Yeah, good morning, Ty. So the biggest thing is if you're asymptomatic, this applies to you. So if you test positive for COVID-19 but you don't have any symptoms, you isolate now for just 5 days instead of 10. The CDC has shortened that isolation period. Also, if you've been exposed to COVID-19 and you have not yet gotten boosted, then also isolate for 5 days before going back out in public. The CDC says there's growing evidence that the first couple of days after exposure and infection are the most contagious. Mask wearing, though, is still encouraged after quarantine. And of course, if you feel sick, then stay home, Ty.
Today, of course, is around the corner, Aixa, and health officials want to make sure New Year's Eve doesn't add to the case count.
Yeah, and New Year's Eve, of course, is about big parties and large crowds. But Dr. Anthony Fauci is recommending against those type of festivities this year because of the highly contagious nature of the Omicron variant. He says even if you're vaccinated, you don't know the vaccination status of others at public gatherings. He says it's safer to spend the holiday with a smaller group of people, family and friends, preferably if they are both vaccinated and boosted, Ty.
All right, Aixa Diaz live for us in Washington. Thanks so much. We will check back in later this morning. Speaking of New Year's Eve, here locally, the city of Sacramento has decided to cancel its New Year's Eve celebration in Old Sacramento. The festivities were just announced last week, and there were supposed to be vendors, a kids zone, and fireworks. It was supposed to be a great time. The city says it was a difficult decision, but on the advice of some public health leaders, they decided to call it off. Quick reminder, if you do head out for New Year's Eve, go with a designated driver if you plan on drinking. Highway Patrol says during their maximum enforcement period over the weekend, 28 people were killed in crashes in the state. The agency also says they made more than 360 DUI arrests starting at 6 o'clock Friday night through midnight Sunday night. That averages out to about a DUI arrest every 9 minutes for perspective. All right, here's a look at where California stands as far as the case numbers. This graph shows you new cases each day since the start of the pandemic. Yesterday, the state reported 20,000 new cases. And while you see the line is going up again, it's not close to what we saw this time last year. At that point, there were 94 cases per 100,000 people. As of yesterday, we're at 16 cases. Also last year, the test positivity rate was 14.7%. That's the percent of tests coming back positive. Right now, it's 5.4%. Let's show you the hospitalizations. Last year, more than 20,000 people were in the hospital with COVID. Right now, 4,400 COVID patients are in the hospital. Some health officials are calling it a perfect storm, the Omicron variant in the midst of a busy holiday season. And as Britt Conway reports, children's hospitals are bracing for more infections.
On the heels of holiday celebrations, heading into the new year, Omicron is spreading. Cases are rising, and now more kids are getting hospitalized with COVID-19. And we're closing in on the record high for pediatric hospitalizations set in September. In Houston, children's hospitals say they're getting ready for more kids with COVID to fill up beds there. With one pediatrician saying, "I think we are going to see more numbers now than we have ever seen." An attending physician and infectious disease specialist at Ann and Robert H. Lurie Children's Hospital in Chicago says case numbers there are 3 times as high as the hospital's previous peak last December. In Cleveland, the director of pediatric infection control at Rainbow Babies and Children's Hospital says effective monoclonal antibodies, a life-saving treatment, is in short supply. State data shows New York City pediatric hospitalizations increased 5-fold over a 3-week period. And in D.C., the infectious disease chief at Children's National Hospital says close to half of the COVID-19 tests that they're doing are coming back positive. But it's not just these cities. Nationwide, on average, pediatric hospitalizations are up 35% in just the past week. Hospitals are bracing for a busy January as health experts continue their vaccination plea.
All done.
I'm Britt Conway reporting.
Meantime, President Biden is ordering the use of FEMA funding to help in COVID testing. The order was issued in a memo yesterday, and it directs the Department of Health and Human Services to use the funding to create and run testing sites in coordination with state and local public health departments. The memo says It's the administration's policy to respond to the pandemic with the full capacity of the federal government. It says that includes the use of emergency and disaster assistance from FEMA to get COVID testing to places that need it the most. The memo also says the funding is fully reimbursable. Here's a look at some long lines of COVID testing lines in our area. This is a line of cars outside the Roseville Galleria just yesterday, where there was a drive-through COVID testing site. The one was open until about 7 o'clock last night. Federal funding to cover funeral costs for people who died from COVID is going largely unused. Families who've lost loved ones can apply for reimbursement of up to $9,000. Authorities say FEMA has paid out $1.5 billion already to 226,000 people since January 2020. But the CDC says more than 800,000 Americans have died of COVID. So the federal government suggests that hundreds of thousands more families have not applied for the money. You can find out how to apply or if you qualify at FEMA.gov.